Good morning, everybody. Thank you so much, Ulrika, and thank you so much, Rami, for your flexibility. My name is Tariq, and I'm Country Director for USAID Global Health Supply Chain. We have a journey of almost 8 years now into investing supply chain management, some of the fundamental issues around family planning and EPI supply chains, but I'll give you just the regulatory perspective from the government side. I'll try to do justice from Dr. Aslam. Looking at the situation of Pakistan, we are a demography of almost 200 million people. We have 5 provinces and 3 regions. So it's, looking at the health systems infrastructure, there are about 16,000 health establishments under public sector, and there is a community-based distribution system. So from a transactional commodity perspective, it's quite some undertaking that government of Pakistan does actually, and then is the private sector. So I'll specifically talk about. Sorry. I think it's the last presentation, but yeah, the context. The drivers where Pakistan was looking at, how traceability and tracking can be actually improved is basically based on some of the drivers. In 2012, Pakistan lost almost 500 children out of measles, and the question was that why these children are dying actually, and the fundamental issue that we found was in the supply chain of the measles vaccine and distribution throughout the system. And then some of the factors like deaths due to cough syrup and a cardiac drug that Pakistanis have been using because of the forfeit and falsification of drugs, that actually prompted Pakistan to look at, the regulatory environment of the situation. And as I said, USAID has been investing in Pakistan in close collaboration with government of Pakistan since 2009, specifically on supply chain management, starting with, $1.5 million, ending with 170. And now under global health supply chain understanding, we are very closely facilitating the government of Pakistan in looking at, how the model that was actually supported under USAID in 2015 can go into a situation where the country actually can go for a regulatory framework and environment, and we can have, tracing and trackability in Pakistan. So looking at the situation, you see from a global perspective and local perspective. I will not go, from even a global perspective, you see that there are 2 vaccines, tetanus toxoids and measles, that was actually coming as a compliance, GS1 compliance, and also 1 product of Pregna. And under USAID support, we actually developed the capacity of the federal government and provincial governments and applied this pilot in 5 locations of the country. And that was quite I would say, a jumping pad for the government to see how, when you apply the science of, a standardization, how it can actually improve the situation. So based on the findings that we had from this pilot in 2015, a report was generated, and Ulrika was very, very kind, and Rami, we have been part of the vaccine presentation and packaging working group. And some of the findings were actually fed, for example, the quality of the barcode and, serialization and so on and so forth. So I think from Pakistan's perspective and also from Ethiopian perspective, it was quite a year where we tried to find out, what does it mean for the global industry and also for situation of our contextualized situations. Yeah, this slide is basically, can I come here? Okay. Sorry, I can see from here. Yeah, so I'll not talk about the benefits. I'm sure, we are talking since yesterday, the benefits of the global GS1 standardization. But I think there's a lot of drive within government of Pakistan and private sector, because, efforts are being made from the government to see how the regulation can be actually, looked after from the standardization perspective. This was a meeting, and thanks again to Rami and Ulrika. She has been supporting this. But we recently had a meeting where Prime Minister actually specifically asked, what does it mean and what are the benefits of standardization for GS1 actually? And we sat down. There's the Drug Regulatory Authority CEO, the Secretary, the Minister. We actually formulated a pager for the Prime Minister. And it went to the Secretariat, and from there, things actually started, moving to the next phase, actually. He reviewed it, the technical people within government actually reviewed it, and now we see that, Prime Minister has actually approved that summary, and I feel very proud that, it has been a partnership where USAID and GS1 are working together with the government of Pakistan to make sure that we have, incremental graduation in terms of realization of things around standardization. And then, I think from there, though it is still with the Cabinet Division, Cabinet Division is the one which actually approves the legislation and regulatory frameworks for the entire country. But I think from the perspective of Drug Regulatory Authority, there's a lot of movement going on, actually. The new rules added to the existing pharmaceutical, labeling rules as an additional requirement to the existing ones. Requirement for GS1 global standards after hectic debates and negotiations at all levels of public offices, regulatory frameworks, and private sector. And this has been seen in an incremental manner. And we are having discussions with the provincial governments and federal government how to unpack that implementation given different experiences from around the world. Yeah, I think, I would like to take this very important from the government of Pakistan perspective that they have actually taken care of all the elements where ownership can be actually, developed after consultations with the public and private sector. So a lot of, work has been done already in the last 3 months. The Drug Regulatory Authority, both at the federal and provincial levels, they have been talking to each other, and then they have taken it to the next level where private sector, manufacturing and sector and associations from pharmacists have been actually involved in some of the important debates and consultations that how we can actually take GS1 standardization to the next level. So a lot of discussion and consultation has gone into action. And I'm very much hoping that, as soon as the Cabinet Division actually approves it, the regulation will be actually, applied to the entire country. Looking at the way forward, I feel very proud Pakistani from the perspective that, I'm trying to be a change agent or a facilitative agent between USAID and Government of Pakistan to look at, supply chain management, fundamentals and see how standardization can save lives of Pakistani children, women and men actually. But I also see that, there's a lot of drive from the government side, and that is translating into meaningful actions. Not necessarily you see the change, abruptly and radically, but I think the discourse that Pakistan has opted, I'm sure it will be unpacking many good ways to look at the legislation and regulation into more of an implementable framework. The other good thing for Pakistan is that some of the international compliance we are already looking at. I'm sure you know more than myself. From the global perspective and local perspective, I see my industry in Pakistan is not compliant to standardization, but at the same time, we're also non-compliant from the global perspective as well, on some of the products. And I think that depends on how the country actually make request on their bidding and procurement rules and regulations. But I think Pakistan is realizing that, once we make this as a requirement, it will make many things, at ease for them. And then the Pakistan Logistics Management Information System. This is one system that is actually hooked with the National Telecommunication Corporation and under collaboration between USAID and Government of Pakistan. This is one platform and logistics information system that actually can look after, the GS1 scanning very easily. The equipment and support and human resource capacity that we built under pilot at 5 locations was very much aligned with, getting this information through barcodes onto a central server, and from there you can actually see what does it mean for the entire supply chain in terms of availability of different products in the supply chain. And of course, by the time you apply it to Pakistan has almost more than 70,000 products, from the local market, so it will be quite an exercise within the country that, how we look at it from an incremental manner. And I'm very happy that, the Drug Regulatory Authority at the federal level and provincial level, they are working very closely with the pharmaceutical sector to gauge, how that incremental standardization will happen in Pakistan over the next 3 years. So we're not saying that, This is a platform, logistics management information system that can actually take care of the hosting of the all information required around GS1. But I think this is one good resource that is available to Pakistan to see how it can be taken into the next phase. And luckily, under a recent understanding between USAID and Government of Pakistan, the framework that we have is basically development of an enterprise architecture for Pakistan that will be looking at how automation of logistics, services data, and other areas can be actually put together on one platform that is available at the click of the button very easily. And in my discussion this morning with Dr. Aslam, he said that they are planning for a 3 years kind of strategy to see how an incremental standardization will happen. They will be prioritizing different products and a roadmap. So with that, I see that the journey that started in 2015, and with all those driving factors which were unfortunate for Pakistan in terms of losing lives of children and women and men for falsified and forfeit drugs, is turning into an opportunity where there is a greater realization that how important it is that we standardize things for the people actually. So from technical perspectives, going into the political corridors of the Government of Pakistan, it will be turning into a great opportunity ultimately for the people of Pakistan. Thank you so much.